Hey, this is Dr. Yates, and I just wanted to update you today on kind of a patient experience that we had with the ARTAS. As you know, a lot of patients have choices these days. You can do a strip, you can do a knee graft, and you can do the ARTAS. I have one of my patients here. This is Randy. Yesterday, Randy did a procedure of approximately 2,000 grafts on the ARTAS robotic system. Now, the reason that this is really important with Randy is a patient that had a strip procedure before. So this is important because he can compare what he had yesterday and compare it to what he had with the strip. Now, he can't compare how the hair is growing, so forth and so on, because we just did it yesterday. But what he can compare is, number one, the whole procedure, pain during the procedure, and kind of the experience overnight. So Randy, maybe you can speak to that. First, I want you to turn around. I want you to show, this is what we call a strip scar. Okay? This is a standard. This strip scar is not bad at all. The width, the length is appropriate because he had about a 2,000 graft case before that. And your hair looked okay, Randy. Is that true?
Oh, absolutely.
Yeah, he was totally satisfied with the results from the strip. The reason he didn't have a strip this time, and I'm going to let him tell you, so it's his own words, but what I want you to see back here, yesterday with the ARTAS robot, we did 2,000 grafts, but you can hardly see any areas of violation where we punched the hair. He's healing greatly, accelerated healing, and this is more the norm than the abnormal. So this is what it looks like day one. So Randy, I'll let you turn around and you can address, was there any difference? Was it?
Oh my God, it's a complete difference. In terms of how I feel today, I couldn't even be here in the office last time.
Why?
Despite the strip procedure being quick and it did have great results, I was pretty much out of commission for at least 3 or 5 days. Just because of the pain, the throbbing. I don't do good with pain meds. I haven't taken any pain medication today whatsoever.
Wow.
Besides I think I only took the 800 milligrams of Motrin.
Okay.
So, and I slept wonderfully. I woke up refreshed, which I thought I was going to wake up miserable. And the first thing I wanted to do was come into the office. And with Robin here bright and early every morning, I was shocked. I text, and at 6:30, she's like, "I'm here." I said, "I'd love to come in and express my gratitude," because unlike last time, not that I wasn't appreciative, but I was miserable.
Yeah.
I was miserable.
Right.
The scarring.
What's that? No pain, no gain. That's what they say, right?
Well, this time there's no pain.
And there's lots of gain.
Lots of gain.
Right.
Absolutely. And
so let me ask you this, Randy. Why do you think people have strips? You know what? Why? I know why you had one before, because you just didn't know about the technology, because it didn't exist then.
Right.
Because you had it 7, 8 years ago.
Mm-hmm.
But why do you think that people who want hair still just run and get a strip? Why do they do that?
Because they just don't know. The bombardment of other establishments just saying this is the only method, preying on people's ignorance. It's sad because it's just the way things are done. I'm glad that you've gone and advanced yourselves. You told me that the first time at that moment it still hadn't passed FDA approval, but soon enough, as soon as it passed, you went and became one of the pioneers, and I'm so grateful I found you again 7 years later. So I had no doubt, I had no fear when I came in on a Friday and we scheduled it for Tuesday. It's because I saw the results before, and now this time I don't have any pain.
I think that's huge, no pain.
So there's no pain, there's no fear. Your team was meticulous. I actually felt bad that they had to work so hard and so diligently on me. I didn't even want to take any breaks. I love them, and I wanted to come back in and express that because I was a big baby yesterday, and that's just me personally with the anesthetic. It takes a lot. I metabolize it a lot, so I wasn't in the best mood yesterday, and they deserve better.
No, that's not true. He was in a great mood. I mean, on a scale of 1 to 10, as far as being a patient, he was definitely a 10 or 11, you know, so that's not true at all. But what I want Robin to do, come in with the camera, I want you to see actually where we placed the grafts. And I'm going to have to stand up here because he had mainly grafts placed in the hairline. He had one weak area here, and he had some placed in the vertex. So this is, you know, roughly around 2,000 grafts. We're also going to place grafts in his scar. We didn't do that yesterday, but we're going to do that in a forthcoming session. But his density was great. The case went well. There were no problems whatsoever. So you can have an ARTAS surgery done after you have a strip surgery done, especially if you don't have a lot of scar tissue back there. And I always say, today is 2014, I'm still not sure why a lot of people gravitate toward the strip if you can have good results with a tiny 0.9 millimeter incision or a 1 millimeter incision in the back, which aesthetically you cannot tell once their hair grows back that they've had anything done. So, Randy, thank you for coming in. This won't be the last time you see me and Randy on camera because, as we always say, the proof's in the pudding. So we have to make sure to show everybody in 8-10 months from now what his hair looks like. And I won't expect anything that his hair won't be anything less than stellar. So thanks again. This is Dr. Yates. Randy, thanks for coming in.
My pleasure, and I've made myself available. I don't work for them at all, but because I've experienced both, I want those folks to avoid any complications. Feel free to contact Dr. Yates' office so that you can ask me any questions via email or phone. I'd be more than glad, because I don't want you to have to suffer through the strip method. And more importantly, I want you to be taken care of by this office. Okay, thanks.
Thanks.